Hey everyone, in this video, I'm going to be explaining what sleep apnea is. Okay, so we talked in the previous videos about what your sleep regulating cycle is, but these disorders that occur while you're sleeping can interrupt quality sleep. And when you interrupt quality sleep, it can lead to a condition known as daytime sleepiness. Daytime sleepiness. And in daytime sleepiness, what happens? This is not narcolepsy. Make sure you know that daytime sleepiness is not falling asleep all the time or not having control of when you fall asleep. That is not at all what this is. Oops, it's not narcolepsy, right? Daytime sleepiness is caused by fatigue, right? Fatigue due to insufficient sleep. Notice here how there's a big difference between fatigue and falling asleep. Narcolepsy is categorized by falling asleep, not having control of when you fall asleep. And fatigue is just a feeling of tiredness that basically doesn't allow you to function. It's lethargic. It's you're super duper tired, but you're not actively you have somewhat of a control of when you fall asleep, although it may not seem like it at times. But basically, why that's important is because diseases like sleep apnea, REM behavior disorder, and so on interrupts your quality of sleep, leading to insufficient sleep, which causes massive amounts of fatigue that may interrupt with your day-to-day functioning, right? So, for example, you can imagine if a person has daytime sleepiness, it's going to interfere with their ability to drive. People can fall asleep behind the wheel, or it's going to lead to decreased cognitive performance, right? Because you can't think when you're tired and so much more. So it's going to definitely interfere, right, with how you function. So that being said, let's talk about sleep apnea. So let's talk about your general airway anatomy here. So this is your upper airway anatomy. You can see how you have your nasal cavity and you have your oral cavity and you have your uvula muscle over here and your pharynx, which is known as your airway. Remember, your pharynx is just nothing but your windpipe and your tongue and all your muscles here. What happens when you sleep is that you're not actively breathing very hard. So your muscles will start to relax, right? They will relax and you'll have a more restful, slow breathing cycle. So you can see here how the pharynx is very open. It allows for a very good amount of airflow to come in. You're able to breathe properly and you're able to get all the air you need while sleeping. But what happens in sleep apnea is these muscles over here, they relax to the point of collapse. Relax to the point of collapse. So your muscles are no longer able to stay open, they just collapse inwards. And you can see here how that gap has turned very, very small in comparison to here, right? So the gap has closed. And why that's so significant is that if your airway collapses, you're not able to breathe. You can't breathe. And not being able to breathe means that you're going to wake up before entering before entering deeper stages of sleep, of slow wave sleep, right? So you wake up before you entered deeper stages of slow wave sleep. And what that means is that you're not getting quality sleep, right? This means that you're getting low quality sleep and actually not even low quality, straight up insufficient sleep, right? Because if you're waking up before your whole slow wave sleep cycle is finished, you're not getting enough sleep. So, how can we treat this? Right? So, one thing you need to know about sleep apnea is it's more common in patients with obesity. So, obesity, it's also common in alcohol drinkers because, one second, let me just finish up writing this. Alcohol is a depressant and it relaxes your body, right? It relaxes your body. And when it relaxes it, it doesn't pick and choose the muscles that it relaxes, right? It will also relax your airway muscles. In addition, obesity, when you weigh a lot, it puts a lot of stress on your muscles and that would cause them to collapse. So, one of the ways to help patients with sleep apnea is to make major lifestyle changes, such as losing weight, reducing alcohol intake right before sleep, and to stop taking sleep pills. So, um, people are going usually not going to take the melatonin gummies or those sleeping pills. They're not usually recommended for those with sleep apnea. But for those who these lifestyle changes have not worked and they need a more serious intervention, they are going to okay, I'm going to move this over the diagram. Apologize. They are going to need something known as CPAP, which is continuous positive airway pressure. I'll write that out. It took me a while to learn that, but it's a very life revolutionizing treatment. So, continuous positive airway pressure. So, using the name, you can kind of infer that the CPAP machine is exerting a constant flow of pressure that forces these muscles to stay open, to create that gap again. So, that allows for you to continuously be breathing without waking up. So, CPAP is basically just going to constantly put pressure, um, constant pressure to keep airway open. And this allows for better breathing, right? So your breathing improves. All right. So that is sleep apnea for you guys in a snapshot. Oh, I'm sorry. I forgot to completely explain the mechanism of it. Basically, CPAP is a device that you're going to put on before you go to sleep. It's going to be fitted over either just your nose or your entire nose and mouth. And there's going to be an airflow that comes in, or kind of like a pressurized push of air that will force your airway to stay open. It's a pretty, my dad, I believe, had it for a few years, and he said that it wasn't really that uncomfortable to sleep with, but I think that might vary from patient to patient. Um, I don't believe that I believe it's actually a pretty reasonable and affordable treatment. And it's changed a lot of lives. I can tell you that for sure. And yeah, so this is my video on sleep apnea. If you were to take away, I think three main takeaways. First is sleep apnea is when the muscles in your airway collapse to the point of or relax to the point of collapse while you're sleeping. And this causes you to wake up before entering deeper stages of sleep. The treatment mechanism for this is lifestyle changes, which include losing weight to relieve the pressure on the airway or to stop the intake of alcohol or other sleep-inducing substances to make sure that your airways aren't fully relaxing, like to the point of collapse. And the third one is a life-changing treatment, which is known as CPAP, which is continuous positive airway therapy, which is a constant stream of or a pressurized air that goes through to your airway to keep it open so that it doesn't collapse. And yeah, thank you so much for watching my video. Have a good day, guys.